In this podcast, we're going to be discussing everything babies with one of the leading pediatricians in the Middle East and in the UK. Hey there, it's Patrick from Eleu Health. Welcome to Evenings with Eleu. So today we have a very special guest with us, Dr. Viviano Sueta, who, as I said before, is one of the leading pediatricians in the Middle East as well as in the UK. And we're going to be discussing a lot of the questions that new parents have been asking around their babies, from feeding to sleep to what happens to our favorite subject, pee and poo. So before we jump right into it, I'll let Dr. Viviano introduce himself and just give us a little bit of his background.
Thank you very much, Patrick. My name is Viviano Sueta. I'm a neonatologist, which means I look after babies most of the time. But I am also a qualified pediatrician, so I do see children up to the age of 18 years. But generally these days, I stick with babies.
All right, fantastic. So, Dr. Viviano, let's just jump right into it. The first thing that we've had quite a few viewers of ours actually throw in some questions, so I thought maybe we'd go through them if you don't mind. But let's start off with the first, and I think probably one of the most important ones, which is feeding, right? So a lot of parents of newborn babies are asking what to feed their baby, right? Is it breast milk? Is it non-breast? Can you just give us a bit of information around that?
Of course, that's a very valid question. We say give babies breast milk. This is what babies are designed to receive. It is optimal for them in terms of growth, nutrition. It is optimal for them in terms of improving their immune system. So it's the absolute best milk for babies. But we accept and understand that some parents, some mothers are unable to breastfeed their babies, and so they may be obliged to provide formula milk. Most formula milk is typically cow's milk. There are other forms of formulated milk from other animals. In this part of the world, goat's milk is fairly popular.
All right, fantastic. So how often do you feed your baby?
As often as your baby wants to be fed, Patrick. You and I feed when we want to feed. Babies are the same. They cry because they want to feed. Sometimes they cry for other reasons, but typically a parent will get to understand when their baby is hungry and they will feed their baby. And once the baby is satisfied, they will relax, go to sleep.
All right. So one of the other questions we have here is, how do you feed your baby?
If you're able to breastfeed, then this is the best way, because in addition to the benefits of the breast milk itself, there are also benefits of the actual act of breastfeeding for both the baby and for the mother. So we would recommend that you breastfeed rather than pump and provide the feed via bottle. But again, as I said, sometimes this is not feasible for various reasons, work or whatever it is, and you may need to pump the breast milk and then feed to the baby via bottle.
Okay, so one of my favorite subjects, because I hated it when that happened with our children, and I still have nightmares about that. When do you transition into solid food, which changes the whole dynamic of that? Because the poo does not smell good at that point. But anyway, we can talk about that later on in the podcast. But when do you transition into solid food?
We tend to advise that transition to solid food should happen somewhere around 6 months of age. But this is variable. Some babies will tell you around 5 months of age that they are ready. So they'll look at you when you're feeding, and they clearly are interested in you feeding yourself.
Okay.
So once that happens, then typically that baby is ready to take on solids. The other thing that you need to bear in mind is that a baby who's taking solids must be able to hold their head upright. So if they've got good neck control, then that's a good time for you to consider giving them solids.
Okay, fantastic. That I did not know about after 2 kids. But then again, I was not, let's say, the main star of that show. So, all right. So after feeding, we have like some very interesting things that happen, right? Like vomiting. So a couple of questions that came around is, are they sick when they vomit after a feed? Is that something that's normal, abnormal? Like, how does that work exactly?
For most babies, they're actually not vomiting. They are regurgitating. There's a little bit of milk that comes up, and that's because the sphincter, or if you like, the valve that separates the swallow tube from the stomach, is not as well developed in babies. In addition to that, usually when they're fed, they then put on their backs, and the milk, which is fluid, will flow back towards the swallow tube. So they get a little bit of regurgitation, and this is normal. It's usually curdled milk that comes up. It's usually small amounts, and it doesn't shoot out of their mouth.
Okay. Well, anyway, in my case, I had a few times where my kids, it's almost seemed like whenever I was the one holding them and burping them, they decided to let loose on me. So I'm sure they were on a schedule, and I think my wife trained them to vomit on schedule, but that's for another podcast. So how do you know if the baby's overfed, right? Like, is vomiting a sign of that, or is that not related?
No, it is related. Vomiting can be a sign of overfeeding. A baby who's constantly either at the breast or constantly being offered a bottle may well vomit because they're being overfed. Now, it's a judgment call. You have to think about how much milk the baby is taking, and you can speak to your pediatrician if you are formula feeding, for example, or feeding with a bottle. Then it's possible to quantify how much milk the baby is receiving. And there are guides as to how much an average baby is likely to take. And so you can make a calculation. But of course, if you're breastfeeding, then you simply have to go on how frequently you're breastfeeding and whether each time that baby takes to the breast, the baby is actually taking a lot of milk.
All right, got it. So after the vomiting, after the feeding, as I'm sure you know, next thing is sleep, right? So I remember, we were probably, of a different generation since our children are older. But I also remember, one of the big things that we had to discuss as parents of newborns was, do we put our babies on a sleep schedule? And, that's very controversial depending on which side of the family you come from, right? So do you have any advice for parents on that?
Yes, so ordinarily you wouldn't need to place your baby on a sleep schedule. Usually when babies feed, they want to go to sleep. They sleep a lot. Babies will sleep upwards of 18 hours a day, and that's normal. So you don't often need to put them on a sleep schedule. You do sometimes have babies who either cry a lot or simply struggle to go to sleep.
Right.
And some babies sleep a lot better during the day and sleep less so at night. Now, if that's the case, then yes, you may want to try and work in a schedule. This can be difficult for the baby and very difficult for the parents because they sometimes struggle with the idea that a baby who's crying may occasionally be okay to allow them to cry for some time, and then they'll settle themselves down.
Right.
And parents are at risk sometimes of overstimulating their babies, and when that happens, then they struggle to get their babies into a nice sleep cycle.
Yeah, actually, you're saying something that's very interesting. So, for us, I remember, one of the things that we were always talking about is when we put our babies to sleep, do we let them sleep with noise or do we go extreme quiet? And one of the debates we had was, well, if we go into extreme quiet, then they become too sensitive to noise and then they'll wake up at anything. So is there a time when this, applies more, like when on younger babies or later on, or is it something parents just have to trust and do themselves?
To an extent, parents do have to trust and do themselves. Some babies, as I say, may struggle to go to sleep, even with swaddling. And those babies may well benefit from having some sort of music or specific sounds played to them, which may encourage them to go to sleep. So you do have to sort of suck it and see.
Well, I made sure that my kids slept to the sounds of basketball and Lakers playing basketball and my reaction to, winning or losing. So, and they seemed okay.
They're all 6 footers.
So they did. Yeah, exactly. They absorbed something. All right. So, any parent advice around sleeping? Right, sleep when your baby sleeps.
Absolutely, you should take the chance when you can, especially if you're a breastfeeding mother. It's quite tiring. You have to produce breast milk. You have to do other things around the baby. So when your baby goes to sleep and you have nothing else pressing to do, it's a good time to kick your feet up. You may not go to sleep, but you might seize the opportunity to just generally relax, read a book, do whatever else it is that keeps you calm. Because some babies will keep you awake quite a bit, and you will get tired.
Yeah, for sure. Again, going back to those days, right? Like we were up at all times of the night, and let's forget that, some of us, if we can take time off, go on paternity or maternity leave, that's fantastic. But sometimes we're not blessed with that. We don't have the capacity to do that, the capability to do that. And so, you have bad sleep and then you go into work and just like the baby, you also want to cry because you're not able to manage it. So, just echoing Dr. Viano, sleep when you can, at least in those beginning months, for sure.
Absolutely.
All right. So, a couple of questions. My favorite topic, because I also have nightmares about this, poo. Well, baby poo specifically. Why does a baby poo right after the feed? Like, it almost seems like it's in and out. Is that normal? Not normal? Is there something wrong? What advice do you have for our listeners and viewers?
It's not in and out. Babies poo because it's a reflex. And it's a reflex that we all have, but as adults and older children, we learn to control that reflex. So when you take in milk or any other food stuff, then your gut assumes that you need to create some space.
Okay.
And so for babies, that happens. But babies are not too bothered about whether or not they are in company or they are alone. So when they take the feed, the reflex happens. But within weeks, usually, this slows down. And
Okay.
so you probably find that they will poop less frequently after their feeds.
Okay. And, at Eleu Health over here, what we do a lot of is we do talk about, bathroom, for sure, about older, about adults, obviously. But when it comes to young children, what are the normal colors? What's the normal kind of consistency of the poo? Where is that inflection point where you go, okay, there's something wrong here?
Another very good question. In the first few days, usually about 2-3 days, the poop will be very dark.
Okay.
That's because of the amount of bile that's been sitting in the gut whilst the baby's been in the womb. After about 3 days, it starts to change color. It might get a bit green, and then
Yes.
slowly it'll become yellow.
Okay.
The consistency will also thin out a bit, so it might seem watery, especially with breastfed babies. It might be watery with what looks like seeds in it, like sesame seeds.
Yeah.
This is perfectly normal. So they have loose stool, it's yellow, and it has seeds. And this is a very good stool for a breastfed baby.
Fantastic. And how long does that last before that kind of goes away and it becomes a bit more solid? Or
Over a few months, it becomes a little bit more solid. Typically, what happens is actually the volume reduces a bit.
okay.
And then with time, it gets a bit more consistent. So it's a bit thicker, tending towards toothpaste consistency,
Okay.
but not white.
I remember that.
And once they get onto solids, then of course they'll have much more firm stools.
Okay. So how often should a baby poo?
In the first few days, a couple of weeks, they might go 4-6 times in a day.
Okay.
That would be normal. The occasional baby will go a bit more frequently than that. So long as you don't have any mucus in it, and certainly no blood, then I wouldn't be too worried at all.
Okay. So next subject is around gas. Some parents over here are writing that they're very worried that their babies are having a lot of gas. Is this normal? What is a lot of gas? What's a little bit of a gas? And what are the things that we should look out for, whether it's smell or anything like that?
Gas will be smelly, but we all have gas, and that's fine. And babies will have a fair bit of it.
Okay.
They drink a lot of milk. The milk contains lactose, and as a consequence, they may produce some gas. So long as the gas is not causing undue distress to the baby, then it's just what it is, gas that we all produce. Some babies will produce so much gas that you hear a lot of gurgling, perhaps, or they pass a lot of wind. If they're passing wind, then they're doing the right thing with the gas. It might come up the top end or it might come out the bottom end. Either which way, as long as it's being released and not causing discomfort or unnecessary bloating of the tummy that's visible to you,
Right.
then it's nothing to worry about. In this part of the world, though, having said that, it's a very common question, and it's an anticipated problem. So parents would tend to say, baby.
So when
is
we're
going to
talking
have
about this
gas.
part of the world, we're actually conducting this this podcast from the Middle East, from the Gulf. But with your experience across Africa as well as Europe, are the concerns around gas different from country to country, from continent to continent?
I think they are somewhat. In Europe, it's less anticipated. Here it is anticipated. So in Europe, it's more observational. So people say, I can hear a lot of gurgling in the abdomen. Is that because of gas? Whereas, as I say here, before they hear, they might anticipate that gas might be a concern, and they may want to do something about it.
Fantastic. So one question that, I also struggle with. So what's the difference between gas and colic? Is there a difference?
There is a difference. Colic is typically described as discomfort felt by a baby that results in them crying for prolonged periods of time and quite excessively. The old definition sort of said, more than 3 hours a day, more than 3 days in a week, and for up to 3 weeks. And it's something that affects babies up to about sort of 3 to 4 months of life, and then it generally settles, and generally settles without the need for any form of treatment. So colic is not really a disease per se.
Okay.
It's an observation, and it's an observation that usually distresses parents to some extent, and possibly, of course, distresses the babies as well. Occasionally, we do have to provide something to see whether there's some benefit from certain medication and or probiotics, which are a bit popular.
Okay. So what are the symptoms of colic, right? So how would a parent differentiate between, a colicky baby and just a distressed baby?
So with
As in
colic,
distressed at that moment.
With colic, it tends to be a little bit more rhythmic, so that it might happen a bit more frequently at around about the same time during the day or night.
Mm-hmm.
Whereas the crying that a baby has not related to colic can happen anytime. And it's usually not as prolonged as you might expect or find with colic. So you're not going to generally find a baby is crying persistently for upwards of 3 hours if that cry is not related to colic. And that's generally the definition.
Okay. Fantastic. I mean, things that I could have used 17, 18 years ago. My God. So one of the next subjects, which I think it's probably one that, has a lot behind it, is around jaundice. We got quite a few viewers who are asking us about jaundice in particular. So, one of the first questions, what is jaundice?
Jaundice is the yellow discoloration of either skin and or the whites of the eyes. And this is produced because we create this pigment called bilirubin. So it's a color. It's a yellow pigment. It's produced by the liver. And it stains the whites of the eyes and stains the skin. But it's safe in the most part. So 60 to sometimes even 80%, depending on whether they're preterm, of babies will have jaundice. And that jaundice that they have is typically safe jaundice. Safe in the sense that it's just a part of the normal progression of development of the liver. The liver is the organ that helps you to remove this bilirubin pigment into the gut and out into the poop.
So what would be the cause of a baby actually just getting jaundice? Is there some sort of trigger, or is it, natural part of, the circle of, birth and the next stages of it?
It is exactly that, Patrick. Maybe you should be doing this podcast.
No.
So
I was well prepped by the questions.
So the liver, as I said, presents this bilirubin and puts it in the poop.
Okay.
Now, whilst the baby is in the womb, the mother does an awful lot because the placenta, which is a very clever organ, clears a lot of substances for the baby in the womb. Once the baby is born, they're obliged to look after themselves, and that includes getting rid of their own bilirubin. So over time, the liver has to understand that they're no longer in the womb and they have to do things for themselves. That takes a little bit of time, and typically we're talking about the first 5 to 7 days of life, by which time they will have their bilirubin levels under control, and so that jaundice sort of fades. And over the next few weeks, what happens is that you won't see the yellow discoloration, not because there's no longer any bilirubin in the system, but just because it's not high enough in the system.
It's not an overflow, basically.
You can't. It's not enough to stain the skin and the whites of the eyes.
So something that, when we discussed off air, that I think is worth, it wasn't a question, but I think it's worth discussing, is apparently there's different types of jaundice, right? So I just thought jaundice was jaundice, but apparently there's different types of jaundice. So maybe you can discuss a little bit about which ones are out there, and, is there one that's more dangerous or less concerning, more concerning, just ideas for us,
Sure.
with newborns.
Sure. So most newborns, as I say, have something called physiologic jaundice. So it's part of the program and it's fine. Occasionally, they have jaundice which is related to breastfeeding, i.e., they are feeding but not quite getting enough. So they're a little bit on the dry side. And so although they have a reasonable normal amount of jaundice or bilirubin in the system, it seems exaggerated because they're dry.
Right on.
And then there are babies who have breast milk jaundice. And breast milk jaundice is caused because the breast milk itself, which is a very dynamic, it's actually an organ in a way, interacts with the body and the gut of the baby, and it retains the bilirubin in the system. This is not a bad thing because bilirubin in itself is a form of antioxidant. Now, people pay good money for antioxidants.
Yes.
These babies are getting it for free. So it serves a real protective
Babies
purpose
get a
for
lot
them.
of things for free, by
They
the
do.
way.
And
The
then
problem
finally-
is when they grow up and they still think they should be getting it for free. But again, another podcast.
And then you have, of course, jaundice that you should be somewhat concerned about. And that's typically jaundice that happens very early on. So first day, baby's born, has jaundice, is not normal. The other form of jaundice that one should be concerned about is jaundice where there is an association with very pale stools. So pale stools, and by pale stools I mean they're not yellow, they're tending to be beige or sometimes almost white, is a stool that is abnormal for any individual, whether that's a baby, an infant, a child, or an adult. So pale stools in association with jaundice are a definite emergency, and you should go see your pediatrician.
Which is actually one of the questions, which is when do I go see my pediatrician, right? So clearly, this is an out of the ordinary situation between the pale stools and the jaundice all at once, right?
It is, absolutely. And I can't stress that enough. Pale stools for any individual, go see your doctor. If it's a baby, take them to see your pediatrician.
And actually, this is a good time to transition or segue into our podcast is meant for general information purposes. It is not diagnosis, it's not consultations. So if you are seeking medical advice, please go and see your doctor. And one of the things that you were telling me off air is that, in terms of coming to see a pediatrician, doesn't mean that you shouldn't be shy to go and see, right? Like you're welcoming to see parents because at the end of the day, as you said, babies can't speak for themselves, right? So,
Absolutely. Parents are the eyes and ears of the babies. So if you have absolutely any concern whatsoever, see your pediatrician. Worst case scenario, we see the baby, we take the history, we examine your baby, and we reassure you. If, on the other hand, you've picked up on something, that's great, because then we can say, well done, you've picked up on something that needs addressing, and it can be addressed.
So, which comes down to probably one of the last questions that we have here, which is, what parting words do you have for parents of newborns, right, who are maybe at the beginning overwhelmed, overstimulated, lacking sleep, getting advice from everyone who all of a sudden is an expert on how to manage and take care of your baby. So what advice do you have or counsel do you have for them?
We're lucky that although we can't understand what babies are trying to say to us, literally every parent has got the right set of antennae for their baby. Trust your instincts. If you have any concerns about your baby, see a pediatrician. More often than not, your concerns are very valid and there's something that needs addressing. Don't be shy, see a pediatrician, trust your instincts, even if you're a brand new parent.
I think those are excellent parting words. And on that, to all of our viewers, thank you very much for joining this podcast. Thank you very much, Dr.
Thank you
Iviano,
very much, Patrick, for inviting me.
No, this has been amazing, and I hope for all our viewers out there, if you enjoyed this podcast, please like and subscribe, as well as leave in the comments any subjects that you would like us to tackle, and as long as it's within our sphere, we're going to get to it. And in the meantime, I wish you health and wellness. Thanks again, Dr. Iviano.
Thank you.
Take care.